Hi, it's Dr. Dean Kane.
And Lauri Kane.
And I get to take care of Lauri.
Yeah.
So today, it is Lauri's desire to improve the tightening and the fullness that has diminished between her temple and her eyes. And in an effort to be able to constantly improve and thinking of ways to improve the things that I do, we're going to try something that has worked out wonderfully. Instead of all the different needles that I use for sculpture, I'm going to use a single cannula technique. So for Lauri, I want to improve on the hollowing that you see in the temple area, the nasojugal fold that you see along and below the eye, and improve overall her entire cheek. As you can see, this is what I've always called the Nike Zoom.
Which
I'm sorry. This is what I call the Nike Whoosh. Okay? Because it's the Nike Whoosh that defines the upper face and it pulls up on the lower face. And so we're going to accomplish that all through one single puncture site. So far, I have prepped the face with an antiseptic called betadine. I've also given Lauri a touch of xylocaine right there so that I could do a puncture point and insert a blunted needle called a cannula underneath. By using the cannula technique, you can see it's much easier to weave through the different layers underneath. And I'm all the way over to here now, and I'm going to deliver the Sculptra directly into the subcutaneous subdermal layer. You can see how it's puffing up.
It's called a tear trough. Be normal. Say normal stuff.
And so I'm ballooning out with the fluid that contains the Sculptra particles underneath through the nasojugal or tear trough fold, just immediately underneath the eyelids for those lines, filling the cheek.
And this doesn't hurt at all. I don't feel a thing. By the numbing he did, I don't feel this needle at all.
And now I'm going to go along the anterior cheek, the medial cheek, and the lateral cheek as we go up into the temple. Now, because Lauri desired a very full amount of stimulation, I am going to do the temple with a separate amount of solution. So the solution itself is little particles of this very interesting medication called Sculptra. And you can see no bleeding, a beautiful puff to her cheek. Most of it is water and local anesthesia. And now we're going to go up into the temple. So these particles are suspended in the fluid, and so I'm delivering the medicine or the particles,
The Sculptra,
which is Sculptra, into the fatty tissues. That is going to stimulate collagen and therefore thickening of the collagen as well. This is different, okay, than injecting hyaluronic acid,
a filler.
volume fillers, okay, which are gels, and attract water to fill the area, whether it be a fold or a crease or a line. But the most important thing here is you can see how far I can reach and how I'm able to find a path with the least potential for injection into blood vessels and still be able to get the improvements I'm looking for. So many, many less needles, much less risk of bruising and injections problems. And here we finish. And now I'll mold it and start the massage process so that you can see. Lauri, can you put ice here while I'm...
I want her to see first. So the reason why I chose Sculptra over a filler is because I wanted the
tightening rather than the filling effects.
the combination of tightening, but I've also lost a lot of collagen in my tear trough, and a filler doesn't always stimulate that collagen. So I chose to do Sculptra, and this technique is, as you see, fills, and it'll take a while to see the results, but over time the improvement is natural and very refreshed looking.